Hello, welcome to HLA Live. HLA Live is our regular broadcast on the HLA YouTube channel as well as all the other social media channels. Each week we talk to interesting people from across the HLA community.
Good evening, everyone. I am really excited to be chairing tonight's meeting.
Hi, I'm Rosie Spooner and I'm hosting HLA Live this Wednesday.
And I'm an HLA Scholar, and I'm also going to be your host this evening.
To share with us their ideas and their innovations and hopefully bring them to a global audience.
Quite quick, we have ideas, let's do this, let's do that. So
many of the topics come from our community, with scholars and faculty expressing an interest in many of the discussions that we're about to have.
Hello everyone, and welcome to the HLA Live session on widening participation in the postgraduate realm.
Homelessness and health.
Addiction and the new normal.
HLA programs are built on 6 pillars. The leader is an innovator and entrepreneur. The leader is a communicator. The leader is a manager. The leader as a negotiator. The leader as a follower, and the leader as a philosopher. If you are interested in becoming a HLA Scholar, why not get in contact? Many of the episodes in HLA Live will cover one or more of these important pillars. The HLA team consists of Pedra, Eamon, Tim, Riddy, Alistair, Adil and Trisha, and a range of other HLA scholars and faculty. Episode 34 of HLA Live is hosted by HLA Scholar Elle Morris. The title is Power, Speaking Out Against Everyday Sexism.
Hello everyone, and welcome to this evening's webinar from the Women in Healthcare Leadership Initiative. We're part of the Healthcare Leadership Academy, and this year, to celebrate International Women's Day, we're going to be leading a series of 4 webinars, each of them having a slightly different focus, looking at equity and equality in gender in healthcare leadership. So we've got a variety of speakers who will be joining us over the next 4 weeks. And tonight we're really starting by looking at power and looking at challenging everyday sexism. So to that thread, we're going to have a series of speakers coming in with their opinions, and I'm just going to start by introducing some of them. So today we're going to have 3 speakers, the first of whom is Zoe. Zoe is a portfolio GP in East Yorkshire. Secondly, we have Christina, who is a paediatrics ST3, also in Yorkshire. And we've got Jessica, who's currently an FY1 at Royal Lancaster Infirmary. So really the first area we're going to have a look at is about narratives and how we define some of these terms. And the first term that we're going to talk about is bullying. So what do you think of that term of bullying? Do you think it has a place within gender equality and discrimination?
So bullying, from my point of view, is an imbalance of power that is used against someone that is perceived as weak. And unfortunately is more than common in the workplace.
So the first part of your question, what do I think of the term bullying? I think very simply it's making somebody feel uncomfortable. And I think especially when we're talking about that with gender discrimination, I would say, yes, it definitely plays a role. And I think it's partly why women can feel uncomfortable in certain situations and men can feel uncomfortable in certain situations as well.
In bullying, you tend to sort of, you often think of your experiences at school, don't you? But in terms of gender equality, I think it's more the kind of belittling behaviours that you tend to get, that you tend to see usually from men, but not always. Sometimes it's other women. And I think that's bullying is distinct from sometimes sexist behaviours, sometimes it's belittling, sometimes it's intentionally ignoring, sometimes it's being, verbally aggressive in an unnecessary way. And there's a really big difference for me between, in a professional environment, being assertive and bullying someone.
I'm an international doctor, an international medical graduate, and in my original culture, women are seen and described as the beautiful and weak sex, and that says a lot about how women are perceived in the workplace.
And it sometimes feels hard to speak up and say in a professional capacity, you know, I think you're bullying me, because it does have those connotations to do with, you know, a young child, but it's still so uncomfortable.
It usually is a person that feels that they have more power over the other person, and also external factors that make the second person feel like they are weaker. And usually that imbalance generates this, unfortunately, this bullying. And it doesn't necessarily mean gender, it means nationality, ethnicity, whether or not you have a disability, children, etc., etc.
I guess the opposite of bullying, which is a much easier question to answer, is treating people with respect. And I think if you ask that question, does just gender discrimination encourage respect? I would say no.
So have you yourself had any experiences of sexism in the workplace at all?
Unfortunately, yes. I don't think I'm at all in the minority when I say that. There is definitely a sexism within medicine. I think it comes in all shapes and forms, really. It's not just between doctors. I think it's also often between patients and doctors. The number of times I've been referred to as a nurse by an elderly patient, because back in their generation, actually, the majority of doctors were male.
I think my experiences are I think, like most women who've been through medical training, there have been various times throughout my career when there's been, I would say, more overt sexism, and that's usually taken the form of inappropriate comments, you know, being the only female in a room, and, you know, maybe the men in the room having a laugh at something. And for the, you know, 99% of the time, that has never been an issue. It's never felt malicious. I felt confident to say if I'm not comfortable. You know, sometimes I've used humour as a way of dealing with it, or just, you know, drawing attention to it. Other times I've just ignored it. But I've never felt uncomfortable with it, and I've never felt that it has had a negative impact.
It actually happened the other day, about 3 days ago. I went to the hospital library, and whilst giving the form to get my library card, obviously when you complete it, you put your title on the form, and then the chap that was the librarian was trying to show me around the library. It was like, oh, I'm just going to go and give you a little tour. And we got to paediatrics. It's like, oh, this is all paediatrics, but also, and then he made a few steps forward, we've got a massive area about nursing. And nurses are really lovely, and I would not be able to be a nurse ever. I don't have the skills to be a nurse, don't get me wrong. But this idea of assuming your role just by your gender or physical appearance or voice, it's just not okay.
My experience of sexism has been the kind of institutional sexism that I experienced when I was working at the BMA. And that's something, you know, I've spoken about, and that triggered the Romney report, the formal inquiry into sexism and bullying within the BMA. But that's a very different environment from clinical work for me.
But I would say I feel very comfortable that I can talk about it, and I feel like the majority of the experiences I've had whilst being a very, very early doctor have been really positive. And, like, for example, the team I work with at the moment are all men, and not once do I feel like I'm sticking out or I'm being discriminated against. It doesn't feel like that at all. But yes, it's definitely something that is prevalent, and it's something that does need to change.
So what do you understand by unconscious bias, and how do you think that might play a role in gender equality?
I think unconscious bias to me is it's the instance when you begin to doubt yourself. And you begin to think to yourself, am I imagining this? Am I being paranoid? And it's usually really subtle things like women's contributions being ignored. Either maybe emails or in a room, not being asked to speak, or speaking and not getting any feedback, or the same point being repeated by a man, and you thinking, I'm sure I said that. You know, it's that kind of behaviour that, because a lot of people seem to be unaware they're doing it, you doubt yourself as to whether it's a real thing.
I'm not sure if you've seen recently in the media, in the BBC, there were two professors invited, one was male and one was female, and the male professor was introduced as Professor XY, and the woman was introduced as Dr. XY. And just little assumptions like that that actually build up. And you just start to think, well, you know, maybe I'm just being a bit sensitive, you know, and it's quite easy to dismiss. But that message of, you know, looking at an environment, looking at a room or an organisation and thinking, there are not other people like me in this room, I think gives you an idea that there's unconscious bias in that situation. And I'm sure that's the same for lots of other things. That's not just gender, you know, that's ethnicity and sexuality and lots of things. Another example would be, I was doing my neonatal rotation, and I had this neon green lanyard around my neck that said neonatal doctor. And even if I had that and it was in capital letters and it was like so bright green that you could not miss it, it was so often for people to say, oh, I'm just talking to the nurse now, or what was worse, once I was finishing my assessment and communicating my plan to the parent, to be asked things like, so when is the doctor going to come and see me? I don't think anybody's doing it intentionally. I don't think it's malicious. But it's just not okay. And I guess the fact that it's not intentional means that it is something that can be addressed with less resistance, hopefully. I think, yes, some people will always be stuck in their ways, and all we can do is try and help half a slightly different way. But yeah, I think unconscious bias is prevalent in all parts of life. I'd say I'm probably unconsciously biased with certain things, sadly, and yeah, I think it's the unawareness that's kind of what we need to be more aware of, and that's what will change, I think.
So a lot of what we've spoken about so far, we've talked a lot about the unconscious bias and also touched on the idea of discrimination and more overt sexism. So one thing we've not really talked about so far is about the bias we can sometimes put on ourselves and kind of self-discrimination. Do you think that plays any role in healthcare leadership at all?
Oh, definitely. And it's really interesting because this term has, I've met this term only just recently, and you would think that it's more commonly spoken about.
I think it's that challenge that a lot of women face in terms of confidence in their own abilities and confidence in their ability to lead and to put themselves out there and to feel that they're able to do things. You know, it's imposter syndrome, isn't it? And I think what I'm learning still is that we are much more reluctant generally to put ourselves in positions.
If you see yourself as someone that is really good at a certain thing and is cut out to be a great, I don't know, surgeon, then of course I think that does help you become a great surgeon.
And I always come back to the you know, the thing at medical school of we used to do back in the old days, we used to do negatively marked exams, you know, and it was true, false, abstain, and if you got it right you got a point, if you got it wrong you lost a point, and if you abstained you didn't get anything. So it was theoretically possible to get minus 100%. And one of the reasons why that's gone out of fashion is because women will not guess. And they did, you know, obviously a whole load of research on this, and they found that generally speaking, men would guess and so had the potential to get higher scores. women wouldn't guess. They would only answer when they were certain and would then abstain. So they consistently scored lower. And I think that is a really good metaphor for how it can be in other sectors of society and in the workplace and in the spectrum of leadership.
Self-discrimination, unfortunately, implies that you end up seeing yourself the way others see you. So instead of looking at yourself as a mirror image, you see the image that everybody else pictures about you. And it brings me back to what I was talking about earlier about the way I was being discriminated as a woman, a junior, and an international doctor. When everybody else around you gives you the impression that you're less knowledgeable than what you're actually, the way you're actually like, in the end you end up believing this.
And so yeah, I do think how you view yourself is almost more important, because if you can view yourself in a positive way, I guess the negative comments can have less of an effect on you. And I think it's all about how you react to the cycle, and sometimes the cycle can't change as fast as you want it to. It can't just suddenly change. It's going to take a long process where almost more and more women will be in these leadership roles, which inspire more women to be in these leadership roles and make more women feel like they can be in these leadership roles, which I guess is the self-belief. But at the same time, I think whilst we're going on that change, it's important to address how we react to those situations as well.
Leadership involves potential talent. It doesn't just involve experience. What you learn comes with time. And also, if you don't see any role models in leadership that are female or in a way that you can resonate with, that's probably better, because it's not just about gender. You're less likely to apply, because you're less likely to think that you might belong in that position. When I was an F2, I was really fortunate to have an amazing educational supervisor. He encouraged me to become a local negotiating committee chair, which for an F2 was a crazy idea, because this position is usually occupied by consultants, and nobody would have thought that an F2 could have done that role. But he supported me and encouraged me to do it. And I managed to revive the LNC, to improve the communications between the LNC and the doctors working in their hospital, the challenge management, and it just proved that actually the misconceptions that or the unwritten rules that society has might not necessarily be applicable.
So I'm just going to move on just a little bit to talking a bit about the impact of this, because so far we've spoken quite generally about discrimination, about bias. So this episode is airing just after International Women's Day, and I think it's quite important for us to discuss what is the consequence of a culture where women feel disempowered.
Oh, I think the culture is so much poorer for it. I think women bring a huge amount, and women bring a very different skill set to men as well. We are biologically different, and the aspects of our personalities, our communication, you are missing out on both the opportunity to use those skills of an individual, but also then to understand the impact that things might have on 50% of the population. And you can't design things, you can't design healthcare, you can't design projects and public health interventions without understanding how women work and think. There's been a whole load of work done on that before, in lots of different spheres, but it just wouldn't make sense, would it? You would never consider having any kind of setup in society with no men involved. You just can't imagine that ever happening. but that's happening all the time with no women involved. You know, it's good old Ruth Bader Ginsburg, isn't it? You know, there will be enough women when there are 9, because there'd been 9 men for years and no one's ever thought that was weird.
I think the consequence is that a lot of very incredible women maybe don't put themselves forward for these roles because they don't feel they either are competent enough, they should, that they'd fit in. A lot of the time it's actually they don't want to be in an environment that they wouldn't feel comfortable. If you're in a male-dominated environment and you don't like that, it's very hard. Even if you know you'd be a great surgeon, for example, I keep using that word, like surgeon, because I think it is still male-dominated. Yeah, I think if you don't feel that's your tribe, that can put you off. So I think, talking in the broader sense, this has a massive effect on how medicine evolves and how women take leadership roles.
I think it is to the detriment of society as a whole at that point, and it's also of detriment to future generations of women. And as the mum of 2 girls, I'm really conscious of the example that I set and that they see around them in terms of female leadership and strong women, strong models.
An important aspect that will influence my answer is the fact that I do come from a country where women are strongly discriminated against. Like I said earlier, because that's Eastern Europe, unfortunately. Like I said earlier, women are seen as the beautiful and weaker sex, and they are expected to be weaker. They are treated as weaker, and if you are different and don't belong in that norm, then you are marginalized or obliged to change in order to belong, which is one of the main reasons why I left. I've always been told that I have a strong personality and that I should change, but there was never a question of what can we do with this potential. We've got this person, regardless of their gender, and they've got this potential to do this and this and this. What can we do? Which is why when I moved across to the UK, and I was fortunate enough to encounter some lovely opportunities and some lovely people, I got so heavily involved in leadership.
Within healthcare, why do you feel that we should care about this issue?
I mean, I think from a healthcare point of view, there's 2 reasons for me. One is in terms of benefit to patients, you know, and that's why lots of us go into healthcare. And historically, the healthcare needs of women have not been prioritised in the same way that they have of men. And I think you only have to look at some of the events over the last 18 months or so, where there's been shortages of key medications for hundreds of thousands of women, like HRT, that has largely gone unnoticed, except for to those patients and to usually the GPs who are trying to get that medication for their patients. And you think if that was a medication that was affecting men, I suspect there would be uproar and people would be up in arms. And one of the reasons is probably because it's predominantly men who are sat in the Houses of Parliament, who are the ones who are lobbying the government, who are complaining about the policies that might have led to that. So there's an inequality there, I think, for patients if we don't take this into account. And then from a healthcare professional point of view, for the last decade, women have outnumbered men in those going into certainly the medical profession. I'm sure it's the case in the nursing profession, and probably always has been the other way around historically. And so you need to have a workforce that can flex, can accommodate the differing needs of women, can accommodate the modern relationships and modern marriages and modern families that we live in, and the difference that there is now than there was, in the 1950s between what that looks like. Otherwise we lose our workforce.
In a team where gender doesn't matter and other protected characteristics don't matter, and all that matters is the individual, you end up having more productive members of your team, but also more fruitful aims.
Women and men should have equal opportunity in all walks of life, and it affects every one of us. Whether you're a woman or a man, you can play a part. So I think that's why it's really important.
It's not just good for women, it's good for men to be able to have better flexibility and to be working in a way that's more balanced and healthy.
One of the hardest things is knowing how to start these conversations, whether that's at a systemic level or whether it's just with our colleagues, and particularly without being confrontational as well, and so that we can collaborate on those discussions. So did you have any ideas, Christina, on how we can start to accomplish this change?
As any change in society, it's going to take some time. It's not going to be something that's going to happen overnight. I think it's really important that we work together. The more awareness we raise and the more ideas we change, the more change is going to take place.
You're running a webinar after Women's Day. Like, I think there's some really positive steps that are being made, and I think you can see that with how the hospital dynamic and the hierarchy is changing.
The BMA is definitely going to do and has done already a lot of work in this area. Actually, a survey on everyday sexism is going to go out in March, so make sure you keep your eyes peeled and complete that survey, because that's really, really important. It's going to give us a very valuable amount of data with regards to what sexism is like on the ground.
I think on a personal level, it's about, I'm a really strong believer in not pulling the ladder up after you. And I think if you, for whatever reason in the past, you know, due to your own circumstances or luck or whatever, if you as a woman are in a position of leadership, then please support other women. Please be open and giving. Please be happy to talk about your experience doing things like this. You know, please support those women who might be coming in. Please perhaps be a little bit more patient, knowing that they might be facing challenges that perhaps you haven't faced or you don't know about. And recognise that they face barriers, particularly if you've got colleagues who are not only female but have other barriers, you know, who may be from minority ethnic groups, or whose gender identifiers may be slightly different. So I think that's personally. And then I think we are becoming more comfortable being able to say, hang on a minute, do we look like the profession we work in? Do we look like the people we represent? Do we look like our colleagues? Do we look like our patients? And I don't mean that physically. I mean, you know, when decisions are being made and you're sat there, well, hang on a minute, this room is not 50% men and 50% women, and it should be, you know, not least on a biological basis, but it should be from a professional point of view, from a population point of view. And I think the more we become confident to say that, and that isn't just gender, that's everything. Anything you're involved with, any workplace, any leadership, it should look like the population that you're working for, particularly in healthcare.
Change is happening slowly on the junior doctor's contract. In the 2018 review, we've managed to agree shared parental leave, which is a step forward towards offering flexibility to our male colleagues, but also allowing our female colleagues to have more ownership over their career. We've also got unconscious bias training and active bystander training in the BMA. And I think these items are really, really important in terms of how we change ourselves as individuals. Unconscious bias, unfortunately, it's something that you have to discover within yourself because it's unconscious. For example, I don't like orange, the colour. I really don't. It's probably the only colour that I don't like. And if I see somebody dressed in orange, there is the chance that I might react a bit differently because I don't like the colour.
To feel comfortable to challenge your unconscious biases that we all have.
And I certainly am more outspoken and braver about that now. And the more I learn about about being a white ally to people of colour, the more I realise actually calling that out is something that's a lot easier to do if you're not the one being discriminated against.
If you do notice in the workplace something happening, somebody treating somebody else unfairly, it's really important to reach out both to the person that was affected to make sure that they're okay, to talk the situation through, because sometimes if you are in that position of being treated unfairly, hearing from somebody that it wasn't your fault, actually you did not deserve to be treated that way, makes such a massive difference.
How could we actually make it easier for our female colleagues who might be being bullied or discriminated against? How can we actually facilitate making it easier for them to speak up?
I think it's a really good question, and it's something that I guess unless you've been in a situation where you've needed to speak up, you might not know who to go to or where you can get support. And I think making it very clear in all trusts and all hospitals who you can go to and you can speak in confidence is really key, because I speak for myself. When I had an incident at my hospital, I didn't know who the Freedom to Speak Up Guardian was. I didn't know that position existed. And I was told about them by my medical school, and I felt very empowered that I could talk to somebody completely in private and know that it wouldn't affect my progression or how I'd be viewed by my medical school, which I think sadly is often a hurdle that a lot of people face, that how is this going to affect their career, and I think that's sometimes I think how bullying can happen, and how it can keep happening. If there's a hierarchy and you're higher up in that chain, it's easier for you to be a bully.
It's only by hearing out the people that are included in a certain category with a certain protected characteristic that we will manage to make change.
So my final question then would be, what support is actually available for people if they do speak up against sexism or against bullying in the workplace?
I think that is a really good question, and I wish I had a really good answer. I think a lot of the support depends on where you're working, and if you're working in the medical profession, then it varies, compared to hospital or primary care roles. There are freedoms to speak up guardians, and they are designed to be there not just for issues around patient safety, but also for issues like sexism and discrimination, to be a first point of contact if you don't know who to go to.
From a BMA point of view, there are a lot of options available. There's the first point of contact. There is an equalities champion in our committees, for example, and I think that's a really good idea that could be taken forward in other areas of leadership in medicine. In a hospital, there's the Freedom to Speak Up Guardian.
As I said, the Freedom to Speak Up Guardian. There's a lot of, like, Civility Saves Lives. There's another really great organisation that is about bullying in the NHS and what can be done to raise awareness of it.
There is the local negotiating committee and the reps on the ground. If I am a rep as well on the ground, and if somebody were to come to me with an issue like that, I would be very happy to carry that forward or to guide them towards what they need to do.
And I think I would encourage people to talk to other women. I think that's the first thing, because it does just help you benchmark and helps you have that, am I going mad conversation. And that certainly for me was a revelation when I started talking to other women when I was struggling, and hearing them go, oh no, you're absolutely right, that is happening, that is going on, and I feel it too. And because that makes you feel more confident. And then hopefully reaching out to people who are in a position to make a change. And unfortunately, that isn't always women. because they're not in those positions. And it isn't always women, because some women do pull up the ladder, and some women don't want you to make a fuss and feel that they've got to where they are by fitting in and not complaining, and therefore you shouldn't be making a fuss.
When you have someone to talk to that you feel comfortable talking about, that is empowering in itself, and then that can make you feel like you're not the only one as well. Like if other people share similar stories or share similar instances or share your same opinion to the situation, that makes you feel much less alone.
It's okay to not feel okay. And I know that sounds like a cliche, but it is true. And once you've built yourself and you have more power to be able to report, you can report it then. It's never too late. But if you don't feel okay to report something, you can wait for a little bit.
That's lovely, and thank you so much for everybody who's joined us today. I know we've only just started peeling away at these questions and topics, but over the coming weeks we're going to go into much more depth, particularly thinking about work-life balance, thinking about mental health and male advocacy, which are topics that we've only started to touch upon today. Further to that, if you've enjoyed this episode, each episode of the Women in Healthcare Leadership webinars is paired with a charity. So the details will be in the YouTube description, they'll be on social media, and the one for today is Doorstep Library London. So if you have enjoyed the episode and you've got a few pennies to spare, please consider having a look at that charity. Other than that, we'll be heading over to Clubhouse and to Twitter to carry on the conversation. Please, if you're going on Twitter, use the hashtags of WIHL webinars or HLA Live and let us know what you thought. And if you're going to join us on Clubhouse, then we'll be able to carry on the discussion. So thank you so much, everyone, for joining tonight. Take care, and I hope to see some of you again next week.
Thank you to everyone that made tonight's episode possible. Whenever our scholars are thinking about complex problems facing our health systems, we encourage them to think about how they make significant change in the world of healthcare. We are incredibly lucky to have some incredible scholars in the HLA. They use the HLA as a platform to take their ideas and bring them to fruition. If you are interested in the work of the HLA, why not join us at one of our future HLA events? Why not join one of our programs? Why not even become a HLA Scholar? Thank you for joining us. My name is Johan Marliner, the Director of the HLA, and it's a good night from all of us.